Hi everyone, welcome back to my channel. In this video, I am going to be discussing 12 mistakes that people make while taking their blood pressure that could result to wrong reading. Okay, so this video is both for individuals and healthcare workers because both of them make this mistake. If you are someone that take your own blood pressure at home, you need to watch this video. If you are a healthcare worker, you also need to watch this video because learning is a continuous process. Make sure you watch this video from the beginning to the end because you will definitely learn something new on this video. And if you have not subscribed to my channel, this is the right time for you to hit the subscription button and make sure you also activate the notification bell so that when next I post any video, you will be among the first people to watch this video. My name is Edith Ndoka and I remain your dynamic nurse. The very first mistake that people make while taking the blood pressure that could result in wrong reading is tying the cuff over the patient or the person's clothes. Okay, so because most of the patients come to the hospital putting on long sleeve, or even if you're putting on, it's easier at home because you can easily remove your clothes, but when they're in the hospital it's difficult most times because most of them are not really comfortable taking off their clothes. Okay, especially in the outpatient. If it is an inpatient, it's easy, they can easily remove it and put on the hospital gown, but most times in the outpatient clinic it is difficult for most of them to take off their clothes. So if a patient is wearing a long sleeve and you take the blood pressure, tying the cuff on top of their clothes, that could result to a wrong reading. The number two mistake that people make that could result to a wrong blood pressure reading is not keeping the patient or the person's arm at the level of the heart. When I say at the level of the heart, I mean keeping your hand, resting your hand this way. The next mistake that people make while taking the blood pressure is you tying the cuff too tight. When you tie a cuff on a patient, this is actually not my size, just for demonstrative purposes, okay? So if you're tying the cuff on the patient's arm, you see this is too small for me, so it's actually difficult to tie. But I'm just using it to demonstrate. So if you tie the cuff on the patient arm, make sure you have at least 2 finger breadth that could enter under the cuff. Okay, if you tie this cuff too tight that 2 fingers cannot enter under the cuff, it is going, when you inflate the cuff, it is going to be too tight and uncomfortable for the patient, and it will definitely give you a higher reading. Okay, but when there is a little space that will enable the cuff to inflate very well and get the accurate reading, then that will be fine. So it is also for your patient comfort as well as getting the accurate reading. The next mistake that could result to wrong blood pressure reading is taking the blood pressure while the individual or the patient is talking. A lot of people do this, especially those that take their blood pressure at home. Okay, it also happens in the hospital because most times when you want to take a patient blood pressure, that is the time they want to explain to you what is happening to them. They want you to take the history at the same time. But if you could, explain to the patient when you're seeking their consent to take their blood pressure, you explain to them, I am going to be taking your blood pressure. It is going to take at least 2 to 3 minutes. And during this time, I will require you to keep quiet as this might affect the reading of the blood pressure. When you tell them that, they will understand and they will keep calm. Okay? Unless if the patient is confused or don't understand or don't obey command, that is a different thing. But as long as they are okay. The next mistake that can result to wrong blood pressure reading is full bladder. I know everybody will be surprised at this. What does the full bladder has to do with the blood pressure reading? Yes, it does. When the bladder is full, it can activate or stimulate the sympathetic nerve. Okay, the sympathetic nerve, you know what it does, increasing all the action and the motion in the body. So you might want to make sure that your bladder is empty before you check your blood pressure. Okay. The next mistake is when when you take blood pressure of an individual while their legs are crossed. So this will be very common for people taking their blood pressure at home as well as in the hospital, because most times if you are a healthcare worker and you don't pay attention to this, you might forget, because because of caseload, we are trying to hurry up and meet up with things. The patient might actually be sitting comfortably, and the outpatient comfortably on the chair with their legs crossed, and you forget, oh, can I check your blood pressure? You left. You will get a blood pressure, but the thing is it accurate? Is it the normal one for the patient? So make sure that the patient is seated comfortably, or the person with their legs apart, okay? Not like wide apart, like normally, not crossed on top of the other, okay? The next thing that you might want to know that will result to wrong blood pressure reading is taking the blood pressure in the wrong arm. The correct arm for you to take your blood pressure is the left arm. Okay, so why? Because the apex of the heart is towards the left. Okay, so when you take your blood pressure at the right side, you might not get an accurate reading. Okay, although there are cases when blood pressure could be taken, on the or in your right arm or on your right arm. Cases like when people that have like breast surgery, okay, of the left side, have fistula, have any, maybe fracture, any condition that will make it difficult for you to use the cuff on the left arm, you can use the right arm. But just know that the most accurate blood pressure is checked on the left arm. Okay. The next mistake that people make that could result to wrong reading is taking the blood pressure on the wrist here instead of the arm. Okay, so most people make this mistake, especially when the blood pressure curve is not the size of patient. So they will just quickly put it on the wrist for convenience and take the blood pressure. It will give you a reading, but it might give you a wrong reading. In fact, it's not even it will definitely give a wrong reading. It might not be like as accurate as when you take it on the patient's arm. The next mistake that people make that could result to wrong blood pressure reading is using the wrong cuff size. Everybody, like, this cuff is a small size. It's not for me. Okay, it actually the cuffs have reading. This is 20.5 to 28 cm. So I don't know your arm circumference. So this could result to a wrong reading if this is a small size for me. You can even know, because when you're trying to lock it, it won't lock like completely. And sometimes when you're inflating it, will just look boom and open. So make sure you use the correct cuff size for each person. Otherwise, you're going to get a wrong reading. Another big mistake that people make that could result to a wrong blood pressure reading is taking the blood pressure when the person is not at rest. Okay, this is a very common mistake both for healthcare workers and individuals at home. Okay, now especially this is most common for the healthcare workers. Most of the patients that come from, I'm not talking about those in the ward, because most time those patients in the ward are either sitting on the chair or lying on their bed, so they are mostly at rest. But patients coming from their home, most of them, they walk. Okay, so when they come into the hospital, because they just came from a walk, this could increase their pulse rate and their heart rate. Their pulse and heart rate. Now, if that person just come and you take the blood pressure immediately, it is definitely going to give you a wrong reading. So the right thing to do is to allow your patient to rest for 10 to 15 minutes before you take their blood pressure. That way you will get an accurate blood pressure reading. Okay, the next mistake that people make that could result to wrong blood pressure reading is taking caffeine just before they take their blood pressure. Caffeine is a stimulant and it would increase the heart rate and every other thing in the body, activities inside the body. So, if you're going to take your blood pressure, please make sure you do that before you take caffeine, okay? So you will not get a wrong reading. The last mistake that people make while taking their blood pressure that you know might be wrong is using one check of your blood pressure to diagnose hypertension. Like probably this person is not at rest or just coming in, to the hospital or just went to the toilet and come back, there is emotion. And then you take the blood pressure, it could be high at that moment. So if you just judge by that one take of blood pressure, oh, this person's blood pressure is high, that means this person is hypertensive. It is totally wrong. Or the person's blood pressure is low, and then you just conclude that the patient's blood pressure is the person have hypertension. Okay, because there's something we call um lying and standing blood pressure. So there are some people, normally when you stand up, your blood pressure should go up, not drop. But some people, when they stand, when they're emotion, the blood pressure drop instead of increasing. So you can't judge by one take. So you need to repeat that blood pressure before you could at rest, okay? Because a high blood pressure will remain high even at rest. So make sure you take a couple of blood pressure before you could conclude or come to a conclusion that this is actually what is wrong with this patient. Thank you for watching from the beginning to the end. I know that you have definitely learned something new. If you know you're making one of these mistakes, please correct them, okay? Do the right thing so you can get the right result. Thank you for watching once again. See you in my next video. Bye.